When circumstances allow, uninterrupted contact is also possible in the event of a cesarean. Without warning, he is lifted out of his mother's womb. After thorough drying, he is put skin to skin with her during the operation. Now everything will feel much better. He is reassured by familiar sounds and smells and can start searching for the nipple at just the right time. This sturdy little fellow finds his way quickly and gets down to business right away. Even after the operation is over and the mother is moved to recovery, baby stays with her. The midwife gives a helping hand. While mother is under post-operative observation, father is responsible for baby when the midwife leaves. Sometimes a mother isn't available straight away. Then father's chest can provide warmth, security, and the sound of a heartbeat. But regardless of how it came into the world, the baby should as soon as possible be placed skin to skin with mother, undisturbed. The baby stays warmest in a maternal nest like this. The skin temperature of a mother's chest increases when her baby is placed there, and the newborn achieves normal body temperature more quickly. Even a heated incubator will not raise the baby's temperature as quickly, not to mention being left alone in a separate cot. Low body temperature and crying uses a lot of energy and can result in the baby's blood sugar going low. Keeping her newborn close feels great for most moms, and it benefits infants in many ways, not least the premature ones. Babies who stay skin to skin cry less. The levels of stress hormones are measurably reduced in both mother and child, and the breasts receive early signals to start producing milk. It's great if the baby looks as if it's trying to eat a big hamburger. For if the mouth is almost closed, as if sucking spaghetti, the nipple may get squeezed and can look distorted after a while, and it easily gets sore. Many babies need time before they learn to open the mouth well. Searching a bit, trying hard. Big disappointment. Try to tease the baby's upper lip with a nipple. Good try, but still not enough. Offer the underside so that the baby has to open wide to catch the nipple. There we go. Again, have a look at what happened. Tempting, sniffing, searching, coaxing again, searching under the nipple, opening wide to catch it. A good latch. Sitting up and leaning back in the bed is usually not an ideal position for feeding. The breasts will flatten and it's harder for the baby to latch on. The exception might be if the baby shows no interest in the breast. If he is then put skin to skin on mother's chest, the right instincts may be activated. The breast is hard, partly because it's swollen. One way of reducing the swelling is to shape your hand like a tulip and put the fingertips in a circle near the edge of the areola. Press for a while. Some tissue fluid will be pushed away, making room for the milk to flow. Then move your fingers around. Remember, short nails. The milk runs upwards from the lower parts. If this causes problems, a lift or a little something underneath can help the milk flow more easily. If the breast is particularly soft, it might help to compress it a bit in order to get the milk flowing towards the baby's mouth. A breast can also be shaped to fit the baby's mouth better, depending on whether the baby is lying across the mother or alongside her body.
Before pumping or expressing by hand, the breast should be prepared. That gives more milk. Try out what works best for you. Soft stroking of the skin, tapping with your fingertips, shaking, knuckles, stimulation straight on, clean hands and stay away from the tip. On rare occasions, tongue tie may cause problems. The baby can't get the tongue out past the gums. This can be painful for the mother, as the child doesn't latch on properly and is struggling. Check if the tongue takes on a heart shape, easiest to see when the child is crying. An experienced doctor can cut the frenulum. It only takes a moment. The same baby a few weeks later. The tongue now comes well forward. Mother's discomfort is over. The tongue may now be placed comfortably under the nipple. The breastfeeding is going much better.
For the first time, you must be prepared for a tiny person to wake you up at any time. Most babies need night feeds for many months. Here, the baby's cot is securely fastened to the double bed. If the baby sleeps next to you, it's no hassle pulling the warm little bundle to your breast. It can be tiring, but night feeding has many advantages. More milk and higher levels of sleep-inducing hormones that help you sleep all the better between feeds. Studies show that mothers who don't breastfeed are just as tired. Babies are calmest near their parents. As long as you're not a smoker or under the influence of alcohol or drugs, and you make sure that the baby doesn't get too hot, give it plenty of space and its own cover, then it's nice and practical that a breastfed baby sleeps close to its mother. Remember that breastfeeding is an investment that gives huge returns, both short and long term. Breastfeeding is going well now. Your child is probably healthier with a better development than she would have had without your milk, and your own health is strengthened for years to come.